Yes, Dr. Majumdar, you had a very interesting case yesterday, that is 11th of August. Kindly, can you talk about that?
A patient, male patient, aged about 60 years, named Sumir Kumar Nandi, who had a fall from about 8-10 feet height when he was working on a diesel loco, and he had fallen down. And most unfortunate part is his abdomen had fallen on the rail track. For that, he had an extreme blunt injury on the abdomen, but from outside nothing was visible. There was a slight bruise mark on his left forearm in the middle part and a small hematoma on the right side of his forearm. But patient's complaint was there was excruciating pain in his abdomen, and he didn't allow anyone to touch his abdomen, and he was continuously telling, I will die, give me some medication which will make me sleep. Then immediately I had contacted our surgeon, who had told to give primary treatment to the patient and see and he suspected that there must be some internal visceral injury. He told that immediately get that USG of abdomen done so that we can assess whether there is any hemoperineum or any solid organ or injury. So immediately we did it. We had seen the ultrasonologist had seen that ultrasonography. He had told that I have never seen such thing, that abdomen is full of fluid. He had called upon our chief medical director also, who is a radiologist, and he had seen, he told that it is a very serious case and maybe...
What was the general condition of the patient at
the patient was deteriorating very fast. Within 20 minutes, patient's extremities become cold and clammy, and the pulse was becoming very feeble. BP gradually came down, and when the USG was being done, it was systolic 60 milliliter of mercury only, but patient consciousness was okay. Patient was talking, and immediately surgeon asked about his condition. When surgeon Dr. Malhotra was communicated about this thing, he told not to waste any time in any further evaluation or investigation.
And it is a credible thing. Within 6 minutes, you have
immediately patient was sent to the operation theater. And once the patient reached the operation theater, we have
then we'll ask Dr. Malhotra. Sir, kindly tell you how you could manage and make the patient survive.
Well, on exploration, we found extensive blood in the peritoneal cavity with a very long lacerated injury to the mesentery. It required resection of 3.5 feet of the gut. There was also a rupture of the liver at the junction of the right and left lobes. The Pringles clamp was used to stop the bleeding blood flow to the liver. The hemostasis was secured and the abdomen was closed. Blood transfusion was given, hopefully.
And how many cases you have seen during your career, such type of cases?
We have seen a few of them, but...
such severe cases?
Yes, we have seen severe cases, but the only thing is that it depends on the organ of injury. This time it was a very long mesenteric injury.
Oh.
Generally, I've never seen such a long mesenteric tear involving 3.5 feet of gut to get resected in an emergency setting. But otherwise...
It is wonderful that within 6 minutes you moved to OT and did a wonderful job in saving the life of the patient.
Now, one thing I want to add, that the good name of our surgeons must have reached to faraway places, because the patient had a RLHS card registered at Bihar Singh, but he was sent here. Actually, I had received at least 8 to 10 phone calls before and after the patient reached at our hospital, and everybody told he is not being referred to Bihar Singh or any other hospital. Whatever paperwork or if required, he must be treated as a honorable patient. They will arrange for everything. But that makes us believe in their belief in our surgical team, and God willing, our surgical team will achieve more such feats in future.
Yes. Today also the medical director showed a lot of praise over our surgical team and their good work. Congratulations to them. Long live the surgical department of Central Hospital Garden Ridge. Thank you.
Thank you.